Thank you, Andy, and thank you, members of the media, for joining us this afternoon. I'm just going to give you a few updates of some numbers. As of this morning, we are caring for 71 patients, inpatient, who are positive for COVID-19. 5 of those individuals are at A.R. Gould Hospital, 52 are at Eastern Maine Medical Center, 3 are at Maine Coast Hospital, 1 is at Mayo Hospital, 6 are at Mercy Hospital, and 4 at Sebasticook Valley Hospital. In addition to that, our home care and hospice team is taking care of 9 individuals who are positive for COVID-19 in their homes. Our 2-week positivity rate is now 11.5%, and over the last 7 days, our positivity rate is 12.4%. What that means is that of every 100 tests that we are performing across our Northern Light labs, 12 individuals are positive for COVID-19. Our employee vaccination rate now stands at 91.3%. We have clinics set up at every one of our member organizations across the state. Each member organization has designated sites with walk-in access. Employees can be vaccinated during work time, and we ask that they work with their leader to do this. In addition to walk-in vaccinations at any of our regular sites, Northern Light Pharmacy has added new local employee vaccination clinics available to make getting vaccinated easier. And with that, I will open it up for questions.
All right, so starting us off today is Maine Public. Patty, you should be able to unmute. Hang on just a sec. You should be able to unmute now.
Thanks very much. Dr. Jarvis, can you just tell us, with the way hospitalizations are going, what's the trajectory that you're expecting to see over the next couple of weeks? Are you seeing any signs of a plateau? Are you expecting your ICU and hospitalizations to reach capacity?
Yeah, so that's a great question, Patty. So just kind of looking at some predictive models, particularly I use the one from the Mayo Clinic. It does project that the state of Maine will continue to see increases in cases per 100,000 over the next week and 2 weeks. They do about a 2-week projection, and that is pretty consistent with what we've seen coming out of other major organizations that do predictive values across the United States. So it's pretty consistent, and that's really what we've been seeing on a day-to-day basis. We continue to see both our positivity rate climb, so that's a general look at what the community spread is around coronavirus, and then looking at our own hospitalizations. Obviously, we have some ups and some downs in that, but the general trajectory is that we will continue to see increasing hospitalizations due to COVID, and particularly around critical care, and that's really a big issue right now. Is critical care beds across the state of Maine. They are in very limited supply. And remember, we're not just using those for people with COVID. We're using those for people who have other needs, people who have been in automobile accidents, people who have heart attacks, people who have other respiratory conditions. There are many reasons why people need critical care. And it's very important that we try to keep those beds open. And the single best way we can do that right now is to decrease the spread of COVID-19. And just as we've talked about in the past, that's vaccination, washing our hands, remaining physically distanced where appropriate, and wearing masks while indoors. So thank you for the opportunity to remind people of that, Patty.
What would you say is the biggest challenge that you're facing right now as a health system?
I think it's this incredible increase in people who are sick and needing much more care than we have seen in the past. So when we talk about these instances of people who are being admitted with COVID-19, this is very different than we saw even last December and January when we initially thought those were going to be our high numbers. As I talked about today, we've already exceeded our numbers from back then. But these people are sicker, they're requiring a lot more medical attention, so that means you're pulling staff and resources to care for one individual, which means they're not available to care for other individuals. And that's where our major concern is across the entire state, is bed capacity, nursing staffing, and the ability to continue to take care of everybody else in addition to those who are afflicted with COVID-19.
Thank you.
Thanks, Patty. Next up, we have Ryan Sullivan, WABI. Brian, go ahead.
Thank you very much, Andy. Dr. Jarvis, can you just give us the numbers of the not 91.3% of people who have indicated they are planning to leave, people who are in the process of being vaccinated, and then the amount that you are unsure of their plans?
Yeah, so I don't have any updates on that, Brian. I'm sorry about that. Typically my partner, Paul Boland, would be here, but he was unable to attend the conference today, and that's usually information that's given out from the human resources side of things. I've tried to focus more on the clinical aspects, and so I don't have any more updates on that.
Well, then maybe my second question isn't for you either, but maybe you could answer. What measures is Northern Light taking in the event that you do lose some staff in a few weeks? For instance, are you planning to call on some colleges like Maine or Husson to help if there is a need for nurses and you do lose some staff?
Yeah, so that's not part of the phase that that I oversee or work upon. I will say that we continue to more focusing in on encouraging our staff to be vaccinated. We think this is the single best way that we can, one, maintain a workforce so that we can continue to do all the things that we are needed to do, but also to protect those individuals themselves and the individuals that they come in contact with. So our focus right now is still on education and providing support for those who are still hesitant to be vaccinated, and trying to reach out to them and understand where their hesitancy comes from and address those head on.
Okay, but you have worked alongside or with college students in the past and that used them through vaccinations. Would that be something that you would be open to if that need arose?
I think those are things that we have to consider along with other measures that are being discussed across the state as to how to augment our workforce, not just because of the issue around vaccination, but simply because of the sheer workload and volumes that we're seeing right now. As you know, traditionally, the state of Maine has an issue with nursing shortages and workforce shortages across healthcare, and sometimes that exceeds what we see across the entire nation. So that's outside of the pandemic and outside of any vaccination requirements. And so we continue to look at every avenue we can in order to support Maine and Maine's communities.
Thank you.
All right, thanks, Brian. Next up, we have Corey, WAGM.
Thank you. My first question is about the positivity rate. I know a lot of the hospitals up here in Aroostook County, including A.R. Gould, are only testing symptomatic individuals. They're not testing for travel purposes or anything like that. Are you guys as a whole following that policy, or what are some factors that you think could be contributing to that high of a positivity rate?
Yeah, so first and foremost, the reason why the positivity rate is that high is because of the community spread that's out there with COVID-19. It is not a statistical anomaly or anything along those lines. I will say that, it is true that we are right now testing. The majority of people that we are testing right now are for clinical indications, but that also includes individuals who were exposed, as well as individuals who are coming into hospitals for procedures or for admissions. And so I want people to understand we are not just testing individuals who are symptomatic, but the majority of the people we are testing are for clinical reasons, and finding that we have an incredibly high positivity rate in that case. And that's the reason why we are not doing as many testing for things like travel, is simply because we have so much disease out there that it is taking up all of our resources in terms of testing. So this really is a very good predictive indicator of what we're seeing in our communities.
Okay. My second question is same along those lines there. With it being a positivity rate of so high, even though I believe Dr. Shaw said we were at pretty much 2/3 of every Mainer being fully vaccinated. Are you seeing a lot of these positive cases are vaccinated individuals with maybe not as much symptoms, not as serious cases, or are the majority of these unvaccinated individuals with much worse symptoms?
Yeah, so the best data we have, both at Northern Light Health and across the state, is in people who are hospitalized. And that's because we get a lot more information by an individual who's hospitalized than somebody who's just showing up at a swab and go site to get tested. In those individuals who are hospitalized, the majority of them are unvaccinated. And those that are vaccinated who have breakthrough cases and are requiring hospitalization, most of them have some other underlying condition that contributes to the severity of their disease. What we see and what we hear from our practices and the doctors who are ordering testing is that, yes, most of the individuals who are positive remain unvaccinated. And that's no different than what we've seen anywhere else in the country. So yes, there is some breakthrough cases, but the percentage of breakthrough cases is low compared to what we're seeing in the unvaccinated population.
Thank you, Corey, for your questions. Next up, we have Arthur, WMTW. Arthur, you should be able to unmute now.
Good afternoon, Dr. Jarvis.
Hello.
My question is, we're seeing from around the country not routine emergencies, heart attack victims, car accidents, where they're being turned away at hospitals for reaching capacity. When do you see, if the infection rates continue to rise, when do you see in the future where you guys might be at that critical stage of reaching capacity and turning people away?
Yeah, so we are not there, and we hope we will never get there. We do everything we can, and Maine has always done a good job of trying to take care of its own, and we will continue to do that as an organization. And so we need to address that as things come. I don't have any kind of predictive model that can tell me how severe that can become as an issue for us. What we do know is that we do need to limit hospitalizations as best that we can, and we are looking at things like non-urgent procedures that could possibly be delayed, particularly if they have a high likelihood of resulting in hospitalization. And so those are being addressed, as we've said in the past, on a case-by-case basis. We don't have any particular policy that's saying right now we can't do this or that, but we do need to keep our beds available for all of those other conditions that come up, those emergent conditions that we need to take care of those people, those unexpected events that happen in people's lives. We need to be able to do that. And if we continue to see rising numbers in COVID cases, that takes bed availability away from patients who need it for other emergent conditions. And so again, this is yet another plea. Please do the things you can to protect not only yourself, but the people around you and the communities that we all serve.
Thank you very much.
Okay, next we have David Horowitz has a question, Dr. Jarvis, but he doesn't have his mic is not working today, so he gave it to me in the chat. And his question is, have you seen an increase in cases for children, and if so, why?
Yeah, so from on a statewide level in terms of positive cases being tested, yes, we've continued to see a rise in individuals, particularly under the age of 20, but even those under the age of 12. So far, Northern Light Health has not seen an increase in the number of cases of children needing to be hospitalized, but we do know that there are cases around the state, and we ourselves have had some cases in the last few weeks as well, just not dramatic numbers, and that's a good thing, and we want to keep it that way. But yes, we continue to see that case rates among children rise. The last report that I saw from the state was about 20% of the positive cases in the state of Maine are in individuals who are under the age of 18.
Before we move on to Chris at News Center, I just wanted to mention that looks like we'll have a little bit of time today. If anyone has a third question they'd like to ask, just let us know in the chat. We may have time to get to a couple of those after Chris's question, so just let us know. Chris, News Center, Maine, you should be able to unmute now.
Hey, Dr. Jarvis, thanks for making the time to talk to us today. I appreciate it.
Of course, Chris, thank you.
I will keep along the same vein because one of my questions does have to do with cases in children. You mentioned a second ago the cases are going up. We had looked at some data from the state that showed it was, I think in the last 2 weeks, so since September began, about 1 in 4, around like 27% of cases are people under the age of 20. What's your reaction to that number?
Yeah, it's scary. Remember, when we talked about this disease 6 months, 12 months ago, we continued to say that, well, everybody was, could get COVID-19. Most people would be either asymptomatic or mild to moderate disease. The risk factors that we talked about back then were, age over 65, certainly age over 70, and people who were obese. And that's just not the case anymore. We continue to see younger and younger individuals who are not only infected with COVID-19, but are having more moderate or even severe disease, many of whom have no comorbid conditions. And you've seen in the news lately several stories of individuals who were otherwise healthy, who unfortunately, required significant levels of care. And unfortunately, some died despite having no other conditions. So when we start seeing numbers like this in our children, particularly now when it's the start of the school year, that's concerning because for children, the number one thing we should be addressing is their health, and the number one, too, is in-person school learning. And both of these are being impacted by this disease. So it's a word of caution, again, to those who are eligible to be vaccinated. Remember, if you are unvaccinated and you get infected with COVID-19, you are much more likely to spread that disease to other individuals who are unvaccinated, including children who currently cannot be vaccinated, and therefore you will spread the disease further and further through our communities. And we need to put a stop to this now, and the best ways you can do that: vaccinate, hand wash, wear masks while out in public, and remain physically distanced where it's appropriate. I can't stress those things enough. And lastly, stay home if you're not feeling well.
And Dr. Jarvis, just to kind of follow up on that same front, I've heard from a lot of parents who have addressed, they've had their own concerns about their kids not being able to get vaccinated, being in these community settings, whether it's their elementary school or at a child care, and concerned about the policies that a school district child care facility may or may not be enacting around COVID-19. What would be your recommendations to parents who are concerned at the, perhaps what I'm hearing from parents is a lack of COVID-19 policies or heightened restrictions? What advice would you give parents?
My advice is that you need to speak up. You need to let people in official circumstances know your feelings about that this is more than people's individual rights and responsibilities. It is about community rights and responsibilities and taking care of everyone within our community. As we've talked about before, there are always going to be those individuals who cannot be vaccinated because of medical conditions or because of age, in this case for children. And there are always those that even if they are vaccinated are going to be immunocompromised. We owe it to them to take care of them. And the best way we can do that is by protecting ourselves so that we don't get infected and then we don't infect those people who otherwise, through no fault of their own, can't get vaccinated or don't have an immune response effective enough to protect them. And so what I say to anybody who has those concerns for your particular local municipality or whatever organization that is bring those concerns to them. Say, we want masks in our schools. We want our teachers and students who are eligible to be vaccinated and support those decisions and speak up about that. Northern Light Health has taken the stance that we support universal masking of teachers, staff, and students in all schools.
All right. Thank you, Chris. Haven't seen any additional questions in the chat, so I think we can wrap it up for today. Thanks all for attending and helping us to get out important information about COVID as always. As I mentioned at the beginning, we will have the high quality video file available in a little bit. We'll send that to you as soon as it's ready. If you ask for it, just let us know in the chat if you like that or by email after, and we'll send that over when it's ready. With that, I think we're ready to wrap up. Thanks again, everyone, for joining us. And have a good rest of your Wednesday.
Thank you, everyone.